Now, Corruption Watch is concerned about the risk of graft in the procurement and distribution of COVID-19 vaccines in South Africa. The organization has asked for clarity from National Treasury on crucial aspects of emergency procurement. It's convinced that only maximum transparency and tight oversight will deter yet another disastrous procurement experience. Let's talk to Corruption Watch Executive Director David Lewis for more about the issues that they're concerned with. David Lewis, good morning to you. Thank you so much for joining us on the show. You've had a few backs and forths with National Treasury. You posed a few questions regarding issues of oversight, transport, storage, and the distribution of vaccines in possibly the largest public health rollout in the country's history. Were you satisfied with some of the responses you got from National Treasury?
Yeah, I mean, they responded pretty comprehensively to the questions that we asked. They've referred us to the Department of Health for certain questions, which they say a better place to answer. But there are still questions, and we have posed now more questions to the Department of Health, and we'll undoubtedly engage with National Treasury further. I mean, look, our concerns are prompted by, a very generally poor record in procurement. I mean, that's where much of the, state capture corruption and other corruption has occurred, is in procurement. And obviously, we also have the very negative lesson of the procurement of personal protective equipment, which was a fiasco to go by. So we're concerned, and we're going to remain concerned, which I think is appropriate under the circumstances.
And speaking about the procurement process, of course, there's been a lot of concern about it and the plan, with some criticizing it, saying that it's not a plan, it's merely an ambitious goal. You asked the question here, what regulations, instruction notes and circulars are relevant or are planned to be issued in relation to the vaccine procurement process? Was that response from National Treasury satisfactory?
I can't remember, I'm afraid. I can't remember exactly what they responded to that, but I think they indicated that there were some, and we want to see any that there are. This program is relatively safe from procurement in as much as there is one purchaser, the government, and as I understand it, the ownership of the vaccine never changes until it's put into the arm of a member of the public. But it's not as though it's sold to the private sector or it's sold to distributors, but there obviously have to be distributors and warehouses and institutions that actually administer the vaccine. And we are worried that that's where the prospect of theft and corruption enters the equation. And that's what our further questions are going to be about. How are you going to decide who gets the contract for the procurement and for the distribution and warehousing and administration of the vaccines? How is that going to be done? What regulations are going to be in place to ensure that there isn't wide-scale theft, as there often have been from state pharmaceutical warehouses? So we're going to be asking lots of questions. And as you said at the beginning of the introduction to the interview, our message to National Treasury and to government generally is that only maximum transparency and tight oversight is going to prevent further corruption. And we're going to be pressing government about that, as I think is our duty and every citizen's duty to, this is this involves massive amounts of money, but it also involves the health of the public, and we can't afford to have it corrupted. I mean, it literally is, a life and death matter.
Absolutely.
It will be for some people at any rate, So we're going to maintain a very close watch over this.
You've also expressed your delight that the Auditor General is involved in this process. How do you believe that this will assist when it comes to your concerns about the massive amount of money that's at stake here and the lives that are at stake?
Well, the Auditor General has right through even the worst days of state capture, proved to be a competent, professional, honest body. The only reason why I think they were allowed to have the quality of the leadership that they have had, which has always been very high and remains very high with the new Auditor General, is because they didn't have power. They didn't have the power to punish transgressors, but only to audit. They do now have some of these powers. But in general, I think the Auditor General's audit capacity is what is needed. And I mean, they were the ones who cottoned on to the corruption in the public, in the procurement of personal protective equipment. So I think it's absolutely vital that the Auditor General be involved in a real-time audit of how this is, or at least of designing the system, because we have to really guard against theft and corruption in this situation.
You also wanted clarity on the exact details on the vaccine rollout plan, which is something that a lot of people have expressed concerns about. What exactly would you like to see within that vaccine rollout plan, in the midst of all the criticism against it?
I mean, my impression, and I'm not an expert on distribution and certainly not of vaccines, but my impression is that there is more of a plan than people are giving government credit for. But there are certain elements of that plan, critical elements of that plan, that are missing. Like, as I said earlier, we want to know, how is this going to be warehoused? How is the cold chain the integrity of the cold chain going to be maintained? Because these things have to be stored at particular temperatures. Who is going to be administering the vaccine? I mean, where are we going to go to get our vaccinations? I mean, obviously hospitals will do it and clinics will do it, but are medical schemes going to be given a certain amount of vaccine to give to their members? Are school premises going to be the kind of places where people go to, or churches? I think those kind of details need to start being revealed. And, in particular, as I say, the procurement of transport, storage, and logistics facilities. From our perspective, that's a vital part of the plan that we need to know. The perspective of an organization that is alert to corruption. But I think just for the general public, be as open as possible, as soon as possible. And that will be a way to engage the public in oversight, and organizations like ourselves and the other professional, more knowledgeable healthcare organizations in helping to contribute to what is the sort of optimal way of distributing the vaccines, of administering the vaccines. Is everything proceeding according to plan? The public are very able to monitor that using, I suppose, the communications facilities and the voice of organizations like ourselves.
In a few weeks' time, the first batch of vaccines is expected to be in South Africa. And as soon as it arrives, the distribution process will be something very important to keep a close eye on. As Corruption Watch, what are you going to be doing to ensure that when this vaccine lands, that it is indeed accessible to the people that it's meant to be, which are frontline workers, as we've heard, without the elements of corruption seeping through?
We'll work out how to look at that. I mean, you're right. I mean, the danger of the sort of leakage of the so-called euphemistically called, of the vaccine is really something to watch for. And so, yes, you're right. I think the vaccines have already been procured for the frontline workers, and indeed it will be given to them first, as should be the case. But there will be plenty who will want to sort of leak this out into the wider world, and that's why we want to know, how are you going to administer this? How are you going to ensure that these vaccines only go to healthcare workers? So, I think the government has procured the vaccines for the healthcare workers, and I think they've procured vaccines in addition to that. And one of the things that we have to know as well, or the public has to know, is how are you going to decide on the priorities? I mean, other countries have done it first with, healthcare workers, and then with people of over a certain age and people with comorbidities. And I imagine we'll follow, a somewhat similar path. That seems to be the, received wisdom. But, tell us exactly what you intend doing with this. And then, tell us, what's going to be in place to, make sure that none of this vaccine leaks out to private practitioners who may want to administer the vaccine themselves at a price. Remember, all the vaccines are given away for nothing. Nobody should have to pay for a vaccine. Nobody should have to pay for a vaccine. But, undoubtedly there will be some people who will want to jump the queue and who have the money to pay for the vaccine, and they'll go to their GPs and ask for a vaccine, and an honest GP, whom I'm sure are the majority, will say, sorry, we haven't got them, or if we have got them, you must get in queue and you must get in line and you must qualify for the administration of the vaccine. Or else they'll say, I think I know, somebody at the hospital who may be able to give me a pack of vaccines, and that will be, 1,500 rand for your vaccine. There must be an administrative system ensuring that that doesn't happen.
And you also asked some clarity on a very important question, I believe, where you say, besides National Treasury, which other departments or institutions will have this oversight function in relation to the vaccine procurement process? And is Treasury, interfacing with them? Why was it so important to really get proper feedback on that question?
Well, I think, we were asking there, and, this got, raised explicitly later about the Auditor General, but, what other departments will be involved? I don't know whether there is any department to be involved other than health and Treasury. And frankly, I would keep it as limited as possible. I mean, if there's an absolute necessity for other departments to be involved, well and good. But, the more people that are involved and the more institutions that are involved, the more difficult the oversight function is. And we are asking that to, I suppose, satisfy ourselves that there is nobody involved in this who need not be involved in it, because it's a recipe for leakage and corruption.
Very well. Thank you so much for your time. Corruption Watch's Executive Director, David Lewis, giving us some clarity there on the clarity that Corruption Watch has requested from National Treasury when it comes to the emergency procurement of the COVID-19 vaccine.